Professor Joseph Ibrahim, who joins us from Melbourne, Australia. He's the head of the Health Law and Ageing Research Unit at Monash University, Melbourne. He was present at the meeting of the country's Royal Commission looking into COVID-19 on Wednesday. Professor, thank you so much indeed. In fact, we quoted you at the start of the programme because you were the person who said you were seeing this disaster unfolding before your very eyes. Why are care homes so particularly dangerous?
I think the care homes are dangerous because older people have multiple diseases and so places them at high risk of dying. The care homes have multiple people in there, so the rate of spread is fast and high. The other thing is that in Australia, the care homes were poorly prepared. And I think this is across the world, that the standard of care and the standard of medical care provided into care homes is less than what people get in the community.
Has the transmission of the virus in care homes increased because of government policies? In the United Kingdom, about 6 months ago, around the start of the pandemic, elderly people from hospital were being transferred to care homes without being tested for COVID-19. I mean, the British government disputes that, but its stats and its facts just don't stack up.
It's a failure of policy. So the problem in Australia was we had plenty of warning from the UK, from Italy and from Spain, and we didn't use the time that we had to better prepare. We had at least 3 months head start on every other country in the world, and we did not act sufficiently to prevent the virus getting in, and we're still scrambling now to treat the people who have got the virus.
I understand in Australia that a lot of workers who are employed in care homes are not actually on permanent contracts, that they're sort of casual workers, and that many of them aren't protected by the government's emergency policies to cover job losses during coronavirus, that a lot of them might work between different care homes. That's clearly a problem, isn't it? Because the transmission can come from the care worker themselves.
So most of the transmissions have come from the care workers. The care workers are predominantly casual in Australia and working between 1 to 3 or many other places. Their salaries are very low, so that they need to go work in different places. And the free market policy in Australia really drove a casualisation of the workforce, because it's cheaper to employ casuals than to give permanent contracts.
Do you think the elderly should be completely shielded while the virus is still out of control? I mean, many countries have loosened their restrictions, but we see the case numbers rising. So clearly, the virus is not under control at the moment.
I think we need to strike a balance where people are able to live their lives, and we do our utmost to protect them. What we have failed to do is everything within our control to protect them and be humane and allow them to live a life that they want. We have the ability to do that. We've got the knowledge and the technology. We're just not using it. We're not paying attention to older people. And it's a disgraceful thing to see. And it's embarrassing for me as an Australian to say that we're not looking after our older people.
Professor Joseph Ibrahim, thank you so much indeed for coming on to the programme. Really appreciate it.